You might have the COVID vaccine right now and not even know it. If you've had surgery or been put under anesthesia and you signed the consent form for them to be able to give you medication during those procedures where you're being put to sleep, they've slipped in a new sneaky word. It's called biogenics. And the next time that you have a procedure or need to be hospitalized and put under anesthesia, these are things you need to look for. On that release form, it'll say like they can give you a blood transfusion and other medications if you need them. But now they've slipped in a word called biogenics. They can give you biogenics if needed. And most people don't know what that means. Biogenics is a sneaky way to say vaccines. So they're putting people to sleep and giving them vaccines without their knowledge and without their consent. That's really fucked up. Now, I'm not sure when exactly they started doing this because this is like a new thing. But I just watched a video of a nurse talking about it. Because these people are having vaccine-related injury symptoms and they didn't have any vaccines that they knew about. And unless you get your medical records, like, you're never going to know about it either. They're not going to tell you until after the fact, if they do tell you at all. And it's not just the COVID vaccine that they're giving people other vaccines too. Whatever they deem medically necessary at the time. You have to agree to that to have surgery. You can specify specifically that you don't want any vaccines. An initial next to it, and they have to follow that, or they can be sued. How do you feel about this? Do you think that's right? Do you think that's morally ethical? Because remember, these doctors all took a medical oath to do no harm. An ethical oath. And if you ask me, that's not very ethical. I'm going to leave this as an open-ended debate, so you can tell me your thoughts.
Since the Affordable Care Act came out, we are now, as nurses, required to ask every single patient when they come to the hospital if you've had your flu vaccine or your pneumococcal vaccine. If you say no to either one of those, in the computer an order will generate that says we need to give you this vaccine. We don't need to speak to a doctor. It's hospital policy. It's now health department policy that we now have to give you the vaccine. Even if you came to the hospital with a stubbed toe, you will be offered both vaccines if you meet requirements, which just about everybody meets requirements for flu vaccine. And most people over the age of 65 will meet the pneumococcal vaccine. Even if you come to the hospital with a stubbed toe, you are going to be given this vaccine. You have the right to say no. If you say no, they just check it off as refused. This was never like this years ago. This is a new thing.
And tell me what we were discussing.